When we talk of gastrointestinal surgery, traditionally most of the surgeries were done by the open method. But over time, we have progressed well technologically and with improved surgical expertise and experience. We are now able to do most of the surgeries laparoscopically. I am Dr. Kona Lakshmi, minimal access and bariatric surgeon at Yashoda hospitals, Somajiguda. What is the difference between why a surgery should be done laparoscopically, or what are the advantages if a particular surgery is done laparoscopically? Main thing is, whenever a surgery is done, the difficult portion of the surgery is the post-surgical pain and sometimes the wound problems which can happen when you are doing these surgeries by the traditional method, where we have a big cut on the patient's tummy. So because of the pain, the person finds it difficult to quickly recover, that is quickly get up, walk around and do their day-to-day activities and then progress to doing their office work. And also because of the pain, the person needs to take lot of painkillers, and that causes lot of gastrointestinal disturbance. That is, in the post-operative period, the person may experience lot of nausea because of the painkiller medicines and constipation because of the painkiller medicines. In some people, there could be diarrhea also because of these medicines. After doing a surgical process, we want the person to be perfectly fit. So we want the person to be quickly getting up from the bed, walking around, eating normal diet and going back to their home with less hospital stay, and also going back to their work with less loss in their office working time. Advance of laparoscopy, we are having good vision systems. We almost now have for our surgical monitors the 4K vision. So with 4K vision, you have a better clarity of seeing each and every organ with minute details, and then we have good energy sources, so we can easily cut and remove the tissues with minimal bleeding. So earlier, for every surgery we used to reserve blood as a part of the surgical preparation, but nowadays we rarely reserve blood unless we are expecting a major blood loss, because it's a very complicated disease. Means the disease has progressed in so much bad way that to cut we may anticipate blood loss. Apart from those surgeries, we rarely reserve blood for these patients. So you are able to clearly see each and every minute detail of the organ you are going to cut, remove or join, and then you are able to cut these structures with minimal bleeding. And then we have very good staplers which are able to join back these organs wherever it is needed to join these organs back with minimal effort from the surgical side. But now with this technological advancements, we are able to do all these surgeries laparoscopically, and the advantage is within 48 hours the patient is discharged. Big bile duct stones which cannot be removed by endoscopy or the spyglass technique can be done by laparoscopic bile duct exploration and remove the CBD stones, and the patient is back home within 24 to 48 hours. And because of the very small cuts, the pain is minimal, and most of the times the only painkiller what we use now is a paracetamol. So with so much of technological advancement, I think people needing to undergo any of the abdominal surgeries should consult hospitals where they are having all this advanced technology available, and the surgeons are very expert at doing these surgeries and undergoing these surgeries laparoscopically rather than opting for an open surgery. For more updates on these type of subjects, like, share or subscribe.